Hello, everyone. Greetings to all of you. I am Priyanjali from beautiful Spotless Skin team, and I'm sure you all must be keeping good health. You must have come across people, especially women, with brown colored patches on their face. They seem like freckle-like spots forming large patches. This is nothing but melasma. Melasma is a common chronic skin condition in India. According to study conducted across 4 Indian cities, revealed that more than 80% of the population present skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin tone is more susceptible to pigmentary disorders. This occurs mainly in women, which is 90%, and 10% of male of all ethnic and racial groups. Around 20 to 30 or 40 to 65-year-old women present a facial melasma. Melasma and hyperpigmentation is generally ignored as a sign of aging and is often misunderstood as a skin condition. Melasma sufferers has been misinformed about aspects of this common hyperpigmentation issue. This can lead to frustration, setback in treatment. To avoid all these hassles and to keep you informed today, we are here to know about management of melasma from our expert. So let's connect today with our skin expert, Dr. Divya Vijayaraghavan from Chennai. She is consultant dermatologist and cosmetologist at Radiance Clinic based at Chennai. She has 15 years of rich experience in the field of dermatology. She did her MBBS from Government Stanley Medical College, Chennai, and post-graduation DDVL from Government Madras Medical College, Chennai. She also did fellowship in cosmetology. She did participate in many state, national, and international conferences. With her expertise today, Doctor will enlighten us more on the management of melasma. So over to you, Doctor. Our first question for you would be, what is melasma?
Hi everyone. Thanks for joining this live program on melasma. Now, coming to the topic proper, today's one of the most concerned skin issue is melasma. Any facial hyperpigmentation, particularly melasma, gives a lot of frustration to these younger generation people too now, because uh, something it's like it requires kind of a multifactorial management, because it's, as you earlier said, it is not just a skin issue. It has a physiology, pathophysiology based on the bodily hormones, as well as our exposure to sunlight and other lights. Apart from these, it's a hyperpigmentation that we get in, particularly in face. Not only men and women nowadays, like even younger generation people are getting it. So this is mostly treated as kind of a chronic issue, because it takes quite a long time to get cured of.
Okay, well, now that we know what is melasma, our next question for you, Doctor, would be, what are the causes of melasma?
Yes, the cause, it has got many causes. First and foremost being hormonal issues like pregnancy, people taking birth control pills after pregnancy, and some women on hormonal treatment get melasma very often as a sign of aging, sometimes genetic. And apart from all these, it can also be caused because of certain drugs, as well as without any specific causes, people may get melasma in certain after certain age group.
Uh, Doctor, as we are talking about the age, please also tell us that is melasma always age specific? Is there a certain age when we normally, have melasma? Is it very common for that certain age, or ladies or women, as we have already known that 90% of the women are mostly, diagnosed with melasma. So, which is the mostly occurred age for this chronic disease?
Yeah, it's an adult onset pigmentation. Most common age group being around 30 years of age. But initially, we see postmenopausal and menopausal women and girls and women in pregnancy getting melasma. But now these days we do see in early 30s and around 20s also, but common around the age of 30.
Well, doctor has just told us that the menopause stage, or when we usually take birth control pills, those can be the reasons of happening of melasma. Doctor, when we talk about melasma, there is another term which is co-related to melasma, which is hyperpigmentation. So how can we differentiate both of them, melasma and hyperpigmentation? How can we differentiate both of them?
As the name suggests, hyperpigmentation. Pigmentation is normal color. Okay, so we do get our skin color because of the melanin pigment present produced from melanocytes in our skin. Okay, that is called pigmentation. Pigmentation can be normal, hypo, or hyper. Hypo is like less pigmentation. We do have certain conditions like vitiligo, certain allergy conditions, and certain nevus where you have lighter pigmentation. Hyper means more. Hyperpigmentation is obviously darker than your regular skin color. So in that case, any pathology or any skin condition that gives darker skin patches in certain spots of the area of your skin, like face or any parts of the body, is hyperpigmentation. Just that the presentation is dark patches. It can be associated with any inflammation like itching, irritation, redness, all those can be associated. So any presentation of skin with patches of dark skin we call hyperpigmentation. Melasma is one type of hyperpigmentary skin disorder. Okay, since melasma is a separate category because it comes under non-inflammation. Like inflammation is some kind of an allergy or like irritant dermatitis or some kind of allergy because of drugs or acne. We call pimples. After post acne, we get pigmentation. Those come under inflammatory hyperpigmentation. Melasma is a non-inflammatory skin condition. So there's no inflammation. Listen, then there's no any kind of irritation or something that causes some reaction in the skin. So melasma is a separate entity where you don't have any, apart from the presentation, you don't have any itching, pain, or any kind of disturbance as signs to the patient who has it. So melasma mostly considered as a hormonal disturbance, but we do have other causes too. So it's one part of hyperpigmentary skin condition.
So, doctor, are we saying that all hyperpigmentation cannot be said melasma, but all melasma can be called as hyperpigmentation?
Of course, yes, you got it right.
Right. So with that, doctor, I think all our audience would want to know what are the early stages of melasma? How do we recognize that this is what happening to our body is melasma? How can we know that?
Yes, the initial presentation it presents as, like there are many types. Most common presentation, like it presents as dark spots or patches in the skin, in the facial skin. Okay, not only women, men also do get melasma. Women are like more commonly affected. So you can't take it for granted that men don't get melasma. Women also get it. So initially it could be like freckles or smaller brownish to gray, brownish to black, black patches over your face, particularly more common over the cheeks, nose, forehead, and chin. It can also occur apart from that body parts also. The most common presentation being face. To start with, it appears as smaller brown spots like freckles. Okay, but if we are not treating it properly and if we are neglecting it, it definitely can grow into a bigger patch. Like you can have a big blemish or a big patch of brown or black pigmentation over your face.
Right. So, doctor, usually what happens, we all know that freckles cannot be treated. You know, it is like we have our skin, that is how we have freckles on our skin. It's very normal. In fact, freckles these days has become a trend. We see girls making fake freckles and, you know, it has become a trend
Yes.
nowadays. So I mean, for the people who are thinking that they have freckles and then they don't treat it, and later on it happens to be that it has turned into melasma. So, what do you have to say for those set of people with those set of mentalities?
All right, freckles is mostly genetic, and in our setup for our pigmentation, freckles is not so very common. So white people and grade 1 and 2 skin types will have freckles. So that has become a trend now. Now girls are going crazy about making an artificial freckles. So freckles are mostly genetic, and it can appear very early age also, and it will be more like darker black to brown pigment. Okay, whereas melasma can appear around third decades, may be associated with pregnancy or sometimes oral birth control pills. In those cases also, like earlier appearance will be light brown to dark brown pigmentation, and it will be slightly bigger in size than freckles. The
Right.
typical appearance over the malar area, cheeks, forehead, nose. So, second thing is it will get precipitated by sun exposure.
Right.
Okay, and if you neglect it, it will definitely grow bigger in size.
Exactly. Well, with that, for all those people who are taking this lightly, we have another question for you. And I'm sure after listening to this, they will take a strict step if they are finding that they have melasma. Well, doctor today is letting all our viewers, all our audience know that if you have an idea in your mind that you might have melasma, then please go to your nearest expert and get it diagnosed. Moving ahead with the next question is, doctor, what can be the risk factors of melasma?
All right. Risk factors, because we do have different types of melasma. There could be just epidermal dermal pigmentation. It is like epidermal is the pigmentation is placed pigment, the melanin pigment is deposited very superficially. That's quite easy to treat. In dermal pigmentation, the melanin pigment gets deposited deeper, and the pigmentation, the impact is more, and it's a little bit difficult to treat too. Okay, there could be mixer type where you yeah, if we do neglect, it can sometimes even epidermal pigmentation melasma can also go into mixed type, and the pigmentation may get deeper. So the deeper the pigmentation get deposited, the difficult it is to treat. All right, and sometimes the earlier treatment you need like kind of lesser strength medicines, and what do we say? The intensity of treatment may be very light. Okay,
Well,
and you like
yes.
for in difficult cases you will need high intensity treatment, and it may take quite a long time.
Right. Now that we know the risk factors of melasma and how can it actually hamper our health, doctor, we would also want to know, because we, of course, we do not want to scare our viewers, we do not want to scare our audience. We also want to know what is the solution to it. How can it be diagnosed?
Of course, first seek a qualified expert in your skin. So you have to consult a dermatologist to get to know how to differentiate a kind of freckles, as you asked me, freckles or some other hyperpigmentation because of some other causes, or just melasma. We have to know the cause. Like anyway, if you get a treatment without knowing the cause, you may end up in treating for quite a long time than what it actually deserves. So in that case, identify your skin conditions from the skin expert, and then go for treatment options. We do have umpty number of options. If there's a precipitating cause, we have to treat the precipitating underlying cause because we have an issue, but there's an underlying man sitting down there. Without treating the underlying cause over here, the the presented skin condition may not go. You may not get rid of it at all. So identify the causative factor, what causing you this melasma or hyperpigmentation. So in some cases, it could be some drug, it could be a hormonal pill, it could be some kind of alternative medicines what they may be taking, or simply some skincare routine which they are following unknowingly that that is the one which is cause precipitating the hyperpigmentation for them. In that case, you have to find out the cause Once you identify the cause, over 50% relieved of the condition. Apart from this, we do have umpty number of treatment options like topical medicines, oral medicines, like pills, how we take for other conditions, chemical peels, lasers. We do have umpty number of options for treating melasma. But the course of the treatment definitely depends on when you are presenting. So if the presentation is earlier, definitely the course is very little. If the presentation is like chronic, it needs a lot of treatment.
Well, this is something very important we have just received from doctor. See, we normally meet a lot of people who suggest that कि आप ये apply कर लो, कि आप ये apply कर लो, skin में ठीक हो जाएगा, आप ऐसे protect कर सकते हो अपने आप को. But we never talk about the reason why we have got it, the reason behind the disease. Doctor very well said today, and I think this is what we needed in this life today. That firstly, please go to your nearest expert, get it diagnosed, know the root cause behind it, and then you move ahead. Please do not listen to every word you get from people around you. Please visit the nearest expert. Moving ahead, doctor, our next question for you is how do we prevent? Suppose now I don't have melasma. I don't need to go to any dermatologist, but so that I don't have it in future, I want to prevent myself from it. How do I do that?
That's the right question, because a lot of people get very anxious about getting melasma in their like early 30s because they have a genetic background, and they do see a lot of females getting presenting with melasma. So in that case, if you have a genetic background, you should treat it earlier in the stage of presentation, like when you have one patch, one very small brown spot, and you feel it is melasma, you can consult a dermat and then you can find a very easy solution rather than growing it up and then taking it in an advanced stage. If I don't completely have a melasma and I don't have a genetic background also, if I'm worried, in that case, following a proper skincare routine itself will help to prevent it in getting melasma.
Doctor, speaking about proper skincare routine, what can we include in our skincare routine, and what is the steps? What are the steps we need to follow on a day-to-day basis?
All right. The common youngsters very common doubt is what do we do to make a skincare routine? So first, like we generally follow CTM regime, which is cleansing, C for cleansing, T for toning, M for moisturizing. So in these, if you're done proper, just if you're doing a proper cleansing, in that case, no harsh chemicals, use the cleanser which suits you. Even if you're using a very little like cleansing milk and those which does not contain any scrub, all those are fine. So don't put too much of cleansing, too much of scrub, all those in your face. So a gentle cleansing is the ideal thing for any skin. Second, toning. The very common question, do I really need a toner these days? Toner, I would say it's an optional add-on because toner helps in um, correcting your skin pH after cleansing and using a lot of products. And it helps in managing the open pores and proper secretion, but kind of a balance in your skin pH. So toner is an option. Instead of toner also, you can use serums like hyaluronic acid, niacinamide. We do get a lot of serums like vitamin
Right.
C. People are very familiar with it. So apart from this cleansing and toning, moisturizing is very important because we do get exposed to different types of temperature these days. We mostly will be sitting in air conditioned rooms, so our skin gets exposed to a lot of dryness. Apart from this, you get exposed to dust, like varying temperatures. You can't even predict the temperature how it will be today and tomorrow. So in those cases, moisturization will definitely help you in maintaining the soft and suppleness, as well as it kinds of gives you a healing touch for the harshness what we face these days. And apart from the CTM regime, I would definitely recommend using a sunscreen on a daily basis. It means like really on a daily basis. Don't skip your sunscreen, particularly when we are prone to get tanned, or someone with background of melasma, or someone who has melasma. No cheat day, no off. Definitely use the sunscreen on a regular basis, because it's not only the UVB, it's not only UVA, it's usual the visible light, the blue light, the screen lights, everything has an impact these days on your skin tone. So apart from CTM, sunscreen is the only thing that protects you from melasma and from like skipping or getting too much of pigmentation these days. This is the one that when you follow on a regular basis, even if you have a genetic background, you can definitely get rid of it.
Right, doctor. We just came to know the importance of, our daily skincare routine, also the importance of sunscreen. Doctor, we also have a conception in mind, whenever we step out of our home, only and only then we need to apply sunscreen. Please let our viewers know how important is it to apply sunscreen even when we are inside our home.
That's what I was telling you. Like in these kind of days, like where we have lots of interior lights, we are exposed to a lot of uh, 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 blue lights, screen lights, and the lights what we use at home itself has an impact on melanin production. In those cases, even if you stay indoors, it's better to apply a sunscreen. Apart from these, when like we are living in a society where you definitely don't know how far you'll be going. It will be stepping out for something like getting some things for the house, for like with the school stuffs, you have to go drop and pick up your kids. You may be going in for a walk. So like if your routine is not very predictable, uh, you have to use a sunscreen as a routine, because like you may not know how much exposure will have the impact, because some people will be working all day out in the sun, they'll have very little impact. Whereas if I'm stepping out of the house, even 5 minutes of exposure can let me go into tanning. It's
Right.
how each people respond to the dosage of exposure. So in that cases, the dosage of exposure, uh, like the duration, the amount of sunlight, the impact of that particular light, how your skin will react, we don't know. Uh, I would say tanning is a bad thing. Tanning is a protective mechanism in our Asian and Indian type of skin. So in those cases, when you are not very predictable, and as a routine, because we are getting exposed to a lot of visible light and infrared rays, blue light these days, it's always better to have a use of a sunscreen. Not only in preventing hyperpigmentation or melasma, but also in preventing or delaying aging. So you have to age gracefully, right?
Right.
In those cases, excess of exposure to these visible light can precipitate or hasten your aging. In that case, using sunscreen as a routine, like, should come as a, a regular follow-up procedure.
Uh, Moving ahead, doctor, our next question is a concern for all the audience, all the viewers. There are a few misconceptions about melasma and hyperpigmentation. Can you put some light into it, please?
Of course, yes, like from our local uh, people, I've heard that when a person, like particularly when a female gets melasma, they consider this as a sign of bad luck. So when you get melasma, they feel you are going to face some difficulty in life, and it's an evil sign. And all those kind of sentiments, bad sentiments, are connected to melasma. As such, it is not like that. It it would have been said in a sense like you have to seek some help regarding that. Okay, like as a caution sign that you have to treat it, because there's something which is underlying. So just go ahead and work out on this. So in that case, you have to like when there is a appearance of melasma, find out if there is something aggravating this, something which we are not very much focused, and maybe that could cause some other problems. This is an early sign. So in that case, the hormonal changes, mm, some drug which we are not accepting. In those cases, we have to identify the particular cause. So using it as a bad sign, it's like baseless.
Yeah, absolutely. Even we think it's baseless, and we are again saying it again and again that please get it treated in the early stages. The moment you come to realize that you have melasma, you don't have to worry because we have a lot of people working on it. There are a lot of people who has spent their entire life dealing about it, so it's nothing to worry about. Doctor, there is also another myth that melasma can cause cancer. Can we talk something about this as well?
Skin cancer is a completely different thing. Different. It's like very vast, but it can be related here. Why? Because melasma as such may not become a skin cancer. Some melanocytic nevus where you have thick black, dark pitch black patches that can present right from birth. But once we are growing like a nevus or something, when we are growing in certain after certain age, it has a propensity to become cancer. But as such, melasma becoming cancer is definitely not. But maybe sun exposure and skin cancer we can definitely relate. Melasma going into cancer is no.
Now I think all the myth has been broken. All the people who are saying that this can be the reason of cancer, let us tell you once again that no, melasma might not be the reason. There can be a lot of other reasons, but definitely not melasma. Moving ahead, our next question for you, doctor, was is melasma due to some allergy or infection? I think doctor has clearly mentioned this, that this is not any sort of allergy or it is not any sort of irritation or infection. In fact,
Yeah.
melasma is something which does not cause any issue, any problem to your skin. You barely would understand, except for the mark you have on your skin. I don't think so there is any other issue. But definitely it is to be treated as soon as possible. Doctor, we have our audience asking us few questions. There are a few questions for you. Purvi Mehra asks, how often should I schedule follow-up appointment for my melasma treatment?
Yeah, there are like few steps of treatment in melasma when you present to your dermatologist. Like there, we in our routine practice we have an intense phase of treatment and then a follow-up phase. So the intense phase may last from 2 to 4 weeks time. So like whenever the presentation is very early, and if there is an intense combination that is being given, I would ideally say 2 to 3 weeks. That first follow. After that, you may have to follow a maintenance regimen where the skin lightening components should be used for quite a long time. So those cases, like after that, the follow-up may be after 4 to 6 weeks.
Okay. We have another question which is, kind of related to the same. We have Shania Sen asking us, when should I expect to see results from my melasma treatment?
God, very commonly asked, eagerly asked question. See, there are two myths. One thing is melasma is not completely curable. That definitely depends on the cause. Second thing is melasma is completely curable. Again, it is the cause uh, what is presenting. Okay, so if there is like if it is pregnancy or just postpartum, you can get rid of this melasma very early. And if it is epidermal, like I said, like the pigmentation deposition will be superficial. In those cases, the treatment will be like you can get rid of melasma completely very soon, like within 2 to 3 months also. Some people need a chronic follow-up, like using a vitamin C serum or kojic acid or hydroxy acid combinations, where you have to follow the post-treatment care up to 4 to 6 months also. But I would rather say, like when you are presenting with a worrying a stage of melasma, at least give it some time of 6 to 12 weeks.
So
So in that
basically,
case, it will be a
right.
good, appreciable response within like 6 to 12 weeks.
Right. Uh, and I think it's not just about melasma. In any sort of treatment, we need to have some patience. Patience
Yeah.
is very much needed. Also, any sort of disturbance in mind, we always say that there is a root cause of every disease. So worrying and having a lot of tension, I think that can, somewhere or the other, it can hamper your health as well.
Yeah, even I want to throw light on this. Like
Right.
when these kind of like acne, be it even acne is considered as one of the most common skin uh, skin rash. So in that case, people in at least once in their lifetime, at least 80% of the people would have had acne in their lifetime. But these days, because of the peer pressure too, I would say, and like social media pressure is there, and a lot of anxiety is there about these skin lesions. Some people are very anxious when it's like when they have a presentation, uh, like a crop up of acne. People present to us with so much of anxiety that they want to get rid of it instantly. So anything in any instant solution will obviously not last long. Okay, so when they are coming to me, okay, fatafat, 3 days you apply this, all will be gone. I really want to insist on this. Like when you have an instant relief, definitely, like not everything will get cleared off instantly. Some things need time. So we have to find out the pathology, take time, get cleared of the results, and sustain the results with good post care. If you are getting something immediate cleared, immediate, not everything will get a immediate relief. Like if you're getting a drug allergy or some kind of irritant contact dermatitis, fine. 5 days you will be completely resolved of a specific condition. Whereas certain skin conditions need time to get it resolved without any side effects.
Well, viewers, audience, all we have to say today is rather than believing every word you listen, trust your own instincts and trust the expert. Doctor, we have another question coming up from Firoz Khan. Firoz Khan asks, what is the long-term outlook for melasma management?
Already depends on the treatment what we are using. Some cases which need an advanced treatment, like if we are presenting quite a little later, or a dermal type of pigmentation or deeper pigmentation, in those cases, we do definitely need combinations with steroids, retinoids, and hydroquinone. Okay, in those cases, there's, as I already said, you will have a bit of a relief immediately, like within 2 to 3 weeks, but there should be a proper follow up with sun protection. In those cases, you have to use the post treatment care that has to be followed up at least for 4 to 6 months. But as I already said, you will get an appreciable result within 4 to 6 weeks, provided you are following a proper sun protection as well as skin lightening regimens.
Right. Well, with Mr. Firoz Khan, I think your question has been answered well. With that, we have Itisha Kaushik asking us, can lifestyle changes impact the severity of melasma?
Yes, of course, there's a big impact of these lifestyle changes, like proper hydration, having a nutritious diet, consuming raw veggies and fruits. As I always tell my patients, like use colored vegetables and fruits, which are rich in antioxidants and beta carotenes that will definitely help you to maintain a very good skin. And definitely, inner health is reflected in your skin. So if your body is not healthy, if your mind is not healthy, your skin will not be healthy. So a healthy skin, the healthy you. So lifestyle changes definitely in the form of proper sleep, which is completely neglected these days. A lot of screen time. Sleep is not given importance. So your tissues, your not only your skin, your organs, your tissues, your blood, everything needs time to repair and prepare themselves for the next task, I would say. So sleep and activity, physical activity, which is definitely very important in the form of like energy as well as proper oxygenation, and your happy hormones will be secreted. Apart from these, proper hydration, because a lot of people are not giving importance to hydration. I really want to insist on having a very good hydration. So if you want to have a healthy physique as well as healthy skin, you follow a good hydration, you definitely will have a good skin. Like you don't need to have a lighter skin tone, but you should have a smooth, what to say, glowy skin. Hydration will do that. Nutritious diet. Don't go for junk. Too much of junk. I would not say like don't go for junk at all. Like keep it as a very rare thing. Nutritious food on a routine basis. Avoid junk, uh, like to like rare occasions. And habits like smoking, alcohol, all those also do have impact on your skin. Not only in hyperpigmentation, in a routine skincare. And apart from these, like if there is any what say, if your hemoglobin is less, and you have to meet to it, because some people are very worried, like if I take an iron tablet my skin will become dark. No, that tone is completely different. Okay, rather than looking pale, you have to look nourished. Definitely lifestyle changes do have an impact in the skin.
Doctor, I'm so glad that we are talking such things at this platform today. I mean, being an Indian, we have a fascination towards fairer skin. We always have, like, however, we try to remove this from the society, but no, people do not accept. We cannot try to understand this thing that having a healthy skin, having a equal tone skin, having a glowing skin is so much important. And of course, agreeing to what doctor says, a wise man once said that आप जैसा खाओगे आप वैसा दिखोगे. So eat good food and you will
Yeah.
definitely look good.
You are what you are in the inside.
Right, absolutely. With that, Dr. Dipshika here seems to be very worried. She asks, is complete clearance of melasma possible with treatment?
Definitely, yes, possible with proper treatment schedule from a skin expert.
Also, doctor, we have Riya Sathi also seems very worried. She asked, can I continue wearing makeup while treating melasma?
On a regular basis, wearing a makeup by using retinoid and steroid, I wouldn't advise. Like on occasion, fine. But some people do have using wearing makeup as a routine. In that case, your skin has to be protected with a moisturizer, using a toner, as well as sunscreen. Apart from the routine, you can use makeup for certain period of time. So once you're off from your work or off from the that particular schedule, you have to wash it with a gentle cleanser. So after cleansing, do not dump your face by applying too many things. Just give it some time to breathe. So in those times, just a moisturizer or just a serum would do. So it definitely depends. If someone is undergoing a chemical heat treatment, using too much of makeup may not give it time to repair, and it may cause a little bit of irritation also. So in those cases, if it is an intense phase of treatment, like by doing a laser procedure or chemical peels or using retinoids, it's better to avoid makeup as much as possible. But when you are in the follow-up phase, like using just vitamin C or niacinamide, I'm in the maintenance phase. In that case, wearing a makeup as a routine also is absolutely fine.
Also, doctor, I think another matter of concern is what products are you using on your skin? There are so many dupes, so many first copies, second copies, in fact, third copies present in the market these days. They copy all the brands, and we see an ample of girls, also boys using makeup these days. So, doctor, what can be the suggestion to all those people who are using dupes and who think that चलो थोड़ा पैसा बच जाएगा, मैं सुंदर तो दिख जाऊंगी? What suggestion do we have for them?
It depends. Definitely, brands do have an impact. But the thing is, it's about the component, what is there in that particular product. Not everything will suit every skin. Okay, so oily skin may need a little bit of intense cleansing, like they do need alpha hydroxy acid, some percentage of glycolic and salicylic acid. If it is a dry skin, you may have to avoid these kind of salicylic acid where you may end up drying your skin more. So you have to select the products according to the components. So if there's a person who gets acne more, in those cases you have to select your moisturizer, sunscreen, everything with non-comedogenic components. So you have to find the word non-comedogenic. In those cases, it will not worsen your acne. While you are using a skin lightener, in those cases, you should not use certain compounds for quite a long time. Say if there's a steroid, retinoic acid, and hydroquinone, these are meant to clear off hyperpigmentation to certain like some duration only. So if it is used for more than 6 to 9 months, like more than 6 weeks itself, I won't advise. Some people use it for more than 6 months. In those cases, you may end up having some kind of unwanted side effect, even like unwanted facial hair and more hyperpigmentation than what you were having previously also. So in those cases, use those products with these specific components for a particular period of prescribed time. Okay, we do see lots of youngsters, like even school and college going people, students using steroids just for skin fairness, which is like absolutely crazy. So if you are not supposed to use these unauthorized medications for these unwarranted period of time. If it is prescribed to you for 2 weeks, fine, use it for 2 weeks, and then go back, consult the doctor who prescribed this to you and ask him or her if I can continue this. If there's a ban, then stop it. If then it should be followed. So even if I'm prescribing you uh, a moisturizer, ask if I can continue this for lifelong. Yes, if it is an okay, then go ahead. If it is no, then you have to ask for the routine product what you have to use. So ending up in a side effect that may be irreversible is like absolutely nobody wants to do that.
Right, doctor. Absolutely agreeing to what you're saying this day. I mean, there is so much to take from this live today, and I do not want to end the live. But I think it's time already. Before you leave, doctor, any suggestion you want our audience to take home this day?
Take home is like with or without any skin problems, follow a routine for your skin. I wouldn't say apply a serum, moisturizer, sunscreen. No, it definitely depends on your routine schedule as well as your skin type. So follow a routine. Second, very, very important, get advice properly designed by a skincare expert dermatologist. So you find your dermatologist and get the expert opinion. Products, as you said, like there are umpteen number of products. If the original as well as the duplicate may look similar, but the end result is completely different. So go for quality products. And before using any product, test it on your skin. Just that my cousin has told me, my friend has told me, don't go for using steroids, just it is giving a good feel or those. But test the product, get the expert opinion. Third, which is very, very important, is use any product on your skin for the prescribed period of time. Beyond that, definitely a no. And if in case of, as we are talking about melasma, once you are getting cured of it and the problem is resolved, and go use the sunscreen without any day off, use it liberally, use it in the prescribed format, and use it crazily. It is fine, absolutely fine.
Well, doctor, thank you so much, doctor and audience. That was Dr. Divya Vijayaraghavan for us. Thank you so much, doctor, for your valuable time. It has been a very, very informative session for our viewers. And also, it was great to hear from you. We look forward to many more such sessions. And for all the viewers, thank you so much for your active participation. We would love if you stay connected to our beautiful Spotless Skin. Thank you so much. Have a great day ahead.
Thank you. Thank you for the viewers, beautiful Spotless Skin as well as IFCO for this great opportunity. Just loved it. I didn't like find it's been like so long. It just went on so nicely. Thank you and
Absolutely.
see you next time.
Thank you so much, Doctor. Thank you so much. It was nice having you here. Thank you so much, Doctor. Thank you so much, everyone.